The Health Department is warning the public of an outbreak of diarrheal disease after 6 people died in Hammanskraal, north of Pretoria. Cases of cholera are also on the rise. To tell us more, we're joined by Dr. Juno Thomas, who's the head of Enteric Diseases Centre at the National Institute for Communicable Diseases. A very good afternoon to you, Dr. Thomas. And maybe if you could start by painting a picture to our viewers as to how bad the situation is at the moment.
So events have unfolded very rapidly over the last few days. There are currently 2 major diarrheal disease outbreaks that the health department has been made aware of. One in the Vredefort and Parys area in Free State Province, and the other in the Hammanskraal area in Gauteng Province. And in the last few days, it has been confirmed that in both areas, at least some of the cases are known to be cholera. So although we aren't sure necessarily that all of the diarrheal cases in those 2 outbreaks are attributable only to cholera, we do know that some of the cases are due to cholera. So this is obviously of major concern.
Absolutely. And maybe if you could just break down to us what exactly would cause a diarrheal disease. Is it the water that we consume, hygiene? What are some of the top things that would cause someone to be exposed to such a disease?
So diarrheal disease is the term that's used when someone develops an illness where the major symptom is having diarrhea. And diarrheal disease can be caused by many different things. It's most usually an infection, and it can be many different kinds of bacteria, viruses, or parasites that cause the infection. And typically, those kinds of diarrheal disease organisms are spread through contaminated water or contaminated food, or in some instances from person to person within the household. So cholera is one of the bacteria that can cause diarrhea. And obviously the great concern with cholera is that it has the potential to cause very large outbreaks, especially in the setting of contaminated water sources.
Yeah, and I mean, once a person has gotten a diarrheal disease, or perhaps even cholera, how quickly can it be detected? And does it always lead to death?
So diarrheal disease does not always lead to death. I mean, as anyone will know, I think that there's hardly a human being who doesn't experience an episode of diarrhea during some time of their life. So it is an extremely common complaint. But certain kinds of infections are more serious than others. And typically we find that young children that develop diarrhea are at much higher risk for becoming dehydrated and dying. And dehydration is typically the most important complication from diarrheal disease. With cholera, it is perhaps one of the most severe forms of intestinal infections, and there people of any age are at risk of becoming very dehydrated. But even with cholera, we know that many people who actually become infected with cholera will have very mild disease, and it's only a small proportion that will actually get really severe disease and need to be hospitalized for further treatment.
Mm-hmm. Doc, you mentioned something a little concerning at the beginning of our discussion, in that there's been a bit of a rapid spread over the parts of the country that you mentioned earlier. And with that in mind, do you feel confident that our public health systems are ready should there be a widespread outbreak through parts of the country?
So I mean, ever since we've had the first few cases of cholera detected in South Africa in early February, I mean, all of the provinces have gone through, preparedness activities, and I think are ready to mobilize rapid response teams and other interventions. But I think the issue is always when you have a single source of contaminated food or water that is then responsible for causing an outbreak in a community. Such outbreaks often happen very, very quickly. So there does need to be a comprehensive response, not only at the healthcare level for treating the individual patients per se, but also at a greater public health level to look at what the possible sources of the outbreak are and what other public health interventions can be put into place.
And then also, what about the treatment of these diarrheal diseases or cholera and the length of time that it would take to treat them?
So most cases of cholera, firstly, will resolve within a few days, and people can typically be treated as outpatients and go home. Cases of cholera are treated with an antibiotic, and it's just a single dose of an antibiotic, but then also they receive rehydration therapy. So, for most people with cholera, if they can tolerate oral rehydration solution, and then they are given a dose of antibiotic, and that should resolve within a few days. More severe cases need admission to hospital and intravenous fluid replacement. Just also, to bear in mind, I think it's that the members of the public just need to be vigilant. It's always young children that are more prone to develop dehydration very quickly once they start with diarrhea, and also older adults. But with cholera, the disease can progress very quickly, and as soon as you start having severe diarrhea, especially if there's also vomiting and you're not able to keep fluids down, then you must go to a healthcare facility to be assessed urgently.
Dr. Thomas, thank you very much for that update and those insights for our viewers. That is Dr. Juno Thomas from the National Institute for Communicable Diseases, talking us through diarrheal diseases and cholera and the outbreaks that the country is seeing at the moment. And just reminding us to not eat suspected contaminated food, and also just be vigilant of the water sources that we expose ourselves to when it comes to drinking water.